Sabrina, ho 50 anni e vivo a Milano.
My name is Dr. Lydia Weyer, 57 years old. We live in Nakuru town.
Mi chiamo Fabio e ho 53 anni.
My name is Timothy Wayamwangi. I'm 59 and a half years old.
La mia famiglia è composta da 6 persone più un cane. Siamo io, mio marito, le nostre 3 figlie, il piccolo di casa e poi Seth. In realtà ci sarebbe anche un settimo che è il coniglio, Luce.
I am married to Timothy. We have 4 children.
Questa è la seconda esperienza che noi abbiamo. Tutto è nato perché si è concluso quello precedente, l'ente a cui noi ci rivolgiamo, che è Albero della Vita, ci ha contattato chiedendoci se volevamo fare una nuova esperienza. Quando hai una chiamata di questo tipo non riesci a dire di no, anzi, nel periodo che non arriva speri che arrivi la telefonata.
This is an idea that we have thought over for over 15 years. At one time, I was working with a charitable organization that used to deal with children who don't have parents. I realized that it is good to actually have a child, mother a child who doesn't have a mother, or give a home to a child who doesn't have. And we discussed with my family. And as they grew up, actually that was long before even our last born, or our biological children, the last one was born.
Probably the issue of having that person adapt to the prevailing culture, because every family unit has its own culture that it has developed.
Intanto i traumi che poteva aver affrontato l'ipotetico bambino o bambina che sarebbe arrivato da noi e anche la paura di non saper condividere l'amore per lui con l'eventuale famiglia biologica. Vedere che il bambino riesce a vivere serenamente entrambe le famiglie e che si riesce ad essere un tutt'uno nell'interesse del bambino.
The greatest joy is, as I said, to help somebody have a sense of belonging to a family unit, because family is the basic unit of social organization.
They realized that even having a family and people you can call family, it's actually a privilege. So many people don't think about it. And they think it is just natural. You are in a family, you have parents, you have your siblings and so on. But to other people it's actually a challenge.
Bene, in modo molto naturale, spontaneo. Sono state accudenti, forse anche appunto perché è arrivato piccolino, quindi è stato più semplice, diciamo. Ma direi serenamente, ecco. Di non pensarci troppo e di buttarsi, perché se ci pensi troppo ti sembra troppo difficile, in realtà quando lo vivi e lo fai è molto più semplice di quello, cioè ti viene più naturale rispetto a quello che potresti immaginarti.
You give also space to understand him or for him to be himself, because again you're not coming to transform him completely to be a new person, because there is also that person in him.
Tutte le paure, tutti i timori sono aspetti che si possono risolvere.
First of all, I would tell them that it is important that they discuss this with their children. The issue of fostering is not between spouses. The children must be involved. They must have a buy-in.
Si trasforma in una bestia furiosa, Hulk che scaraventa ogni cosa, butta tutto giù.
I'm now glad to introduce the Italian speakers, starting from Mr. Gabriele Rabaiotti, the Honorable Counselor of Social and Housing Policies, Madame Adriana Champa, Childhood and Adolescence Policies, Ministry of Labour and Social Policies, Madame Silvia Zandrini, Director of the Second Level Social Services of the Municipality of Milan, and Madame Michela Bondardo, Technical Coordinator of Foster Care Services. I can hand over to you for a very, very brief presentation before we start. So, Mr. Gabriele Rabaiotti, I wish you to invite for your presentation. Thank you.
For the promotion for education, to welcoming, and also to reinforcing social and civil responsibilities in order to improve, support the abilities of our communities. The social fabric and families within the society, within the social fabric, they all have to feel involved when it comes to helping children, especially those children who are more vulnerable. So we are working with a group of families here in Italy and also in Kenya. We have to work so that this group of families grows more and more, and it becomes stronger and stronger, because together with you, we need to find the right answers that our children deserve. So thank you from Milan, and I wish you a fruitful session.
Yeah, thank you so much, Mr. Gabriel, for that presentation. At this point in time, I wish to invite any questions from the participants concerning the presentation that has just been made. You can use the chat box or just raise your hand. I see no questions, so I request to proceed.
So I'm going to repeat again the interpretation. So there's interpretation going on. So you have to go at the bottom of your screen, there is a globe button. Click on it and choose language. So you choose English because you're not Italian speakers. You choose English and you'll see English interpretation. It's very clear. But remember to also mute original language. Right now I'm speaking. There are some of us who can't hear me because you stuck to the Italian booth. So after the Italian speakers speak, you have to leave and go back to the main room where you can be able to listen to the conversation right now in English. Thank you so much.
Thank you, Jennifer, for the very important instructions. And I would like to thank, on behalf of all of us, the Councillor Gabriele Rabaiotti for the very interesting opening remarks, pointing out the importance of families and strong partnership between private, social, and public. Thank you very much. And now I wish to invite for the next presentation Madam Adriana Champa from the Ministry of Labour and Social Policies of Italy. Welcome.
Good morning to everybody and welcome. I will continue in Italian if you agree. Credo che voi abbiate la presentazione.
Well, I think you do have my presentation, probably, right? Do you have my presentation?
We are going to show it in a few seconds. So you can proceed. Thank you.
Thank you. I don't see anything, but I will continue from my desktop. Okay. Va bene, continuiamo così.
So you need to switch off the interpretation yourself.
Allora, io sono Adriana Champa,
dottoressa Champa, scusi, solo una cosa, mi dicono che deve spegnere l'interpretation dal suo computer. She has to switch it off.
Ho disattivato prima, ma è andato via tu. Disattivo. Ok, proviamo così. Mi sentite adesso?
Yes, we can hear you. Yes, yes. Thank you.
Proviamo così. Pardon for this inconvenience. Della conoscenza nell'ambito delle mie competenze c'è anche quella del diciamo in azioni di indirizzo, monitoraggio, sostegno agli interventi per l'affidamento familiare. Questo per, diciamo, per motivare la mia presenza qui oggi, per la quale ringrazio per l'invito. L'affidamento familiare in Italia ha un percorso che ormai possiamo dire, diciamo, anziano più che antico. La prima legge che ha introdotto nel nostro ordinamento l'istituto dell'affidamento familiare è la legge 184 del 1983, che è stata poi riformata nel 2000 dalla legge 149, arricchendone i contenuti e adattandola alle esigenze mutate. Come si inserisce l'affidamento familiare nell'ambito dell'ordinamento nazionale italiano? Nel 1983 venne fatta questa riforma che introdusse due istituti fondamentali, quello dell'adozione, che prima diciamo dove il giudice, i servizi prevedano che la situazione sia reversibile, che i problemi possano essere risolti, ma che temporaneamente il bambino abbia bisogno di di un ambiente familiare diverso che accompagni e si affianchi alla famiglia d'origine. Ecco che il legislatore prevede l'istituto dell'affidamento familiare. Quindi un istituto che si pone come di ausilio alla famiglia d'origine per garantire il diritto del bambino ad una famiglia, ma possibilmente poi a rientrare nella propria famiglia d'origine. Questo diciamo è la base del nostro sistema normativo, e va detto però che il primo passo che il legislatore chiede che magistratura minorile e servizi verifichino, prima ancora di procedere verso la valutazione dello stato di abbandono e quindi intraprendere il percorso dell'adozione, oppure verso verificare la sanabilità delle problematiche e quindi intraprendere il percorso dell'affidamento familiare, o se necessario o se l'affidamento non dovesse essere lo strumento più appropriato a cui ricorrere, il collocamento in comunità residenziale, che in Italia comunque hanno l'obbligo di essere quantomeno organizzate in a family way, quindi secondo un'organizzazione di tipo familiare. Il legislatore chiede ad amministratori, servizi, magistratura minorile di verificare se con un supporto precoce, con l'attivazione di strumenti di sostegno domiciliari, si possa evitare l'allontanamento del bambino dalla sua famiglia d'origine e quindi andare a supportare le funzioni genitoriali al fine di evitare che le situazioni diventino ulteriormente ancora più complesse, e quindi per garantire anche il permanere del bambino all'interno della propria famiglia. Questo è il quadro, quindi il legislatore pone in primo luogo, chiede in primo luogo agli operatori sociali, agli operatori giudiziari di verificare se con sostegni mirati la famiglia possa essere supportata e quindi possa essere garantito il diritto del bambino a crescere nella propria famiglia, quindi evitare l'allontanamento. Laddove si valuti che questo tipo di interventi non siano sufficienti, verificare se con l'affidamento familiare, quindi con un allontanamento temporaneo e l'affidamento ad una famiglia affidataria, la famiglia d'origine possa essere in grado di affrontare i propri problemi e risolverli. Laddove o laddove non l'affidamento, ci sono casi in cui l'affidamento non è indicato, quindi si procede al collocamento in comunità, sempre però con l'idea, nel caso del temporaneo, dell'intervento temporaneo, che poi il bambino o il ragazzo possa rientrare nella propria famiglia d'origine una volta superati e risolti i problemi. Sta andando troppo avanti con le slide, le dico io quando cambiare. Adesso sto facendo un attimo l'inquadramento normativo. Mentre invece laddove le situazioni si ritengano insuperabili, interviene lo strumento dell'adozione con la rescisione del legame familiare. Questo è il quadro normativo. principio a base del nostro agire è il principio dell'appropriatezza. Che vuol dire principio dell'appropriatezza? Vuol dire che ad ogni modo sempre la valutazione dello strumento, dell'intervento a sostegno, a protezione, a tutela del bambino va verificato secondo la valutazione di quello che è l'intervento più appropriato. E questo è un punto fondamentale perché non esiste la migliore soluzione, esiste la soluzione migliore per quel bambino, per quella famiglia. Detto questo, voi sapete che l'Italia è organizzata in un'organizzazione amministrativa centrale e organizzazioni amministrative regionali con diverse suddivisioni di poteri anche di indirizzo e di organizzazione e anche di attuazione normativa. In questo dialogo tra Stato centrale e livello regionale, che è il livello che definisce poi la programmazione delle politiche sociali e comunque delle politiche dei servizi sociali all'interno del quale si colloca anche il servizio per l'affidamento familiare. Quindi nel dialogo tra Stato e Regioni nel 2012 si sono definite delle linee di indirizzo condivise e comunemente definite e approvate in conferenza Stato-Regioni. Può andare avanti. Conferenza Stato-Regioni che costituiscono il nostro, ecco qui, che costituiscono il nostro strumento di operativo. Queste linee di indirizzo nascono da 3 anni di ricerca su tutto il territorio nazionale, anche con seminari itineranti, di raccolta di buone e cattive pratiche in materia di affido familiare, che hanno coinvolto regioni del nord, del centro, del sud, enti locali virtuosi, enti locali meno virtuosi, che hanno testimoniato e che ci hanno raccontato come funziona il servizio per l'affidamento familiare. E dalla raccolta di queste informazioni abbiamo tratto 2 strumenti fondamentali. Come vi ho anticipato prima, le linee guida per gli amministratori è un documento di raccomandazioni per gli amministratori locali che serve all'amministratore locale per indirizzare l'organizzazione, per definire quelle che sono le caratteristiche principali che il servizio per l'affidamento familiare di accompagnamento alle famiglie affidatarie deve avere per essere un servizio efficiente. Può andare anche avanti. Nelle linee guida sono tratteggiati, sono innanzitutto individuati quelli che sono gli operatori, quelli che sono gli stakeholders necessari deve adottare per svolgere in maniera efficace la propria opera. Vengono descritte le professionalità necessarie per lo svolgimento del servizio, le attività di informazione e formazione necessarie. Ho già detto che viene descritto in maniera dettagliata quello che è il metodo per la definizione del progetto individualizzato e per l'attivazione dei dispositivi di ausilio, quelle che sono le istituzioni coinvolte e le modalità di coinvolgimento delle istituzioni. A seguito dell'approvazione delle linee guida per l'affidamento familiare, il materiale, può andare avanti, il materiale che abbiamo ulteriormente raccolto, che è ancora di più stato tradotto nelle raccomandazioni e le linee guida, può andare ancora avanti, è stato utilizzato per la definizione di un secondo strumento di ausilio per operatori e famiglie, che è appunto il manuale sull'affidamento familiare, parole nuove per l'affido, che è una vera e propria, diciamo, Bibbia, un vero e proprio documento di accompagnamento all'associazionismo familiare e le famiglie che non sono ancora affidatarie, ma che magari hanno in animo di approdare a questa esperienza. Quindi, due strumenti, le linee di indirizzo per gli amministratori locali, ausilio nell'ambito del proprio territorio, e il manuale per operatori e famiglie di ausilio, anche con esempi, buone pratiche, eccetera, che è invece uno strumento molto più operativo per gli operatori sociali, assistenti sociali, psicologi, eccetera, ma anche per le famiglie. Può andare avanti? Al fianco, diciamo, di queste ancora avanti, a fianco di queste linee guida, abbiamo varato poi le linee guida sulle comunità di accoglienza e le linee guida invece su quello che dicevo prima, cioè il famoso articolo 1 della legge sul diritto del bambino a rimanere, diciamo, a crescere nella propria famiglia, che cioè le linee guida sugli interventi di sostegno alle capacità genitoriali, soprattutto per le famiglie più vulnerabili, che è quello che noi in Italia chiamiamo programma Pippi, che è un programma, diciamo, che è stato sperimentale per molti anni, che oggi è un programma a regime, diciamo, in fase di implementazione su tutto il territorio nazionale, che prevede una presa in carico a tempo ed intensiva, attivando una serie di dispositivi, tra cui quello più importante è l'accompagnamento, diciamo, il sostegno domiciliare, per evitare, diciamo, per andare a sanare quelle che sono le problematiche della famiglia, che però si ritengano non di grave negligenza, quindi una negligenza che non porti all'allontanamento, e che quindi prevenga la cosiddetta istituzionalizzazione. È un programma molto interessante. Da questo programma ne discenderà a brevissimo la definizione di un livello essenziale in materia di infanzia ed adolescenza. Tradotto significa che l'Italia si darà come diritto esigibile su tutto il territorio nazionale il diritto ad avere, laddove emergano situazioni di disagio per le quali non è previsto, diciamo, per le quali non è doverosamente azionabile il percorso dell'allontanamento o proprio dello stato di abbandono, quindi diritto a che gli siano attivati i dispositivi della presa in carico intensiva e domiciliare, con l'attivazione di un'equipe multidisciplinare integrata. Credo di aver detto tutto, forse qualche numero vale la pena ricordare. Dall'ultima rilevazione, l'Italia parte, insomma vi ho detto che il percorso iniziato è un percorso antico, ma diciamo, il legislatore ha cominciato a interrogarsi sulla deistituzionalizzazione agli inizi degli anni 70, quando è partito in Italia tutta la riflessione sulla deistituzionalizzazione a 360 gradi, a cominciare diciamo dalla cosiddetta legge Basaglia, quindi dalla chiusura dei manicomi. Quindi il processo di deistituzionalizzazione nasce nei primi anni 70. Nei primi anni 70 in Italia c'erano oltre 200.000 ragazzi collocati nei cosiddetti istituti per minori. Oggi i ragazzi fuori dalla famiglia d'origine, che ovviamente depurati del numero dei minori stranieri non accompagnati, che
okay. If we take that number, the number today is way different, is way lower. And of course, we're not considering here those children perhaps who are here because they're immigrants and because perhaps they lost the parents. And so taking those numbers aside, so if we take that number nowadays, it is 28,000. 50% of them are in a foster care scenario. The other 50%, they're being welcomed by family-based communities for minors, for children. Well, we don't really know now what's going to happen. Let me tell you, let me be very upfront. The objective of the ministry, of the central government, is not so much to lower that number of children in foster care and being in the institutions, being in communities. Well, let's say that the objective is for the children to actually have the most appropriate action being taken for them. And meanwhile, of course, we try to prevent, for instance, poverty scenarios in families, which unfortunately are often leading to children being taken away from their families and welcomed by institutions. Well, of course, in those bad events, when there are abuse, or let's say we need to protect children, then in that case, of course, that is something that we do not really, I mean, it's something that, of course, brings the child away right away because of the risk of danger and so on. Of course, I'm absolutely welcoming questions, comments, and observations from your side. And this is all for me now. Thank you.
So that the presenters can be able to respond. We will start with we can start with Grace Mwangi, please.
Good morning, everyone.
Good morning.
Yeah, thank you so much. What has captured my heart is just a remark or observation. It's allowed the prevention, really putting efforts to work within the family environment to prevent a child being removed. That is very remarkable and very and quite encouraging, because any other form of care, you have to really work hard around foster care or any other form of care you place a child. So the initiative to put efforts within the family, it is very important, and I hope it is something that we can uptake in Kenya so that there will be reduction of many children going out at the initial stages when there is detection of some kind of concerns in terms of care or child protection. Again, the other thing that is quite encouraging, and I hope it's something that we can practice in Kenya, is having a team of practitioners that have different capacities or skills so that they can be able to detect something needs to be done at the early stages rather than waiting until some challenges have been there. The presentation was very informative, and it's my hope that there will be the lessons we pick from this can help us strengthen the families and do foster care that can be supportive to the children that are being separated from their families into the institutions of care. Thank you again.
Now we can give the chance to Mercy Karanja. Sorry, Mercy Kimati, sorry. Mercy Kimati, please give your question.
Thank you so much for the opportunity, and I'm so glad to participate on this exchange. And I'm happy to learn that the Italian government do recognize the practice of social workers, unlike here that we don't even have a body. And my take home is the appropriateness. We've just talked about that when you're coming up with a care plan, you usually have so many plans for this particular child, but appropriateness is very crucial. You need to come up with the appropriate action plan for this particular child. So my question goes to the presenter, and I'm asking, how do you ensure that you regulate the practice of social work in Italy?
Thanks a lot. How do you regulate the practice of social work in Italy? That is the main question. Lastly, we can give the last question to Faith Kamau. Please. Thank you.
Recording in progress.
Faith Kamau, are you there? Okay, I think she has put it on the Q&A. She says, kindly explain residential community. Kindly explain residential community. So let's give the chance to Madam Champa to be able to respond to the questions that have been presented. Thank you.
Allora, le domande, se non ho capito male, sono due.
Okay, I understand you were asking two questions. So how do we regulate the practice of social workers and the definition of family-based community or residential community, as you named it. Now, social workers were being established back in 1970s. So the role of social workers were being established back then. There is a code of ethics that they have to abide by. And of course, they may also go to university to learn the relevant skills for them to become professional social workers. So they have a school, an education background when it comes to execute interventions on more vulnerable people, such as children. When it comes specific to foster care, again, from a social worker standpoint, let's say that social workers, they do develop appropriately on how to handle foster care. so it is amongst their skill set. But when I was mentioning earlier on the guidelines on how to support social workers, well, indeed, that is one of the tools that social workers are actually making use of, so that they can actually execute the foster care solution at their best. And here, in this case, we're not just talking about social workers, but also psychologists, for instance, residential educators. So there are a number of practitioners involved. And also, let's not forget school, because actually school, the overall education environment is important. So speaking through to teachers as well as healthcare professionals. So let's say healthcare professionals, along with all these other practitioners that I mentioned. In Italy, we do have children pediatricians who are also supporting both children and families in making sure that they can stay with the family. So we are happy to make those guidelines available to everybody. They're written in Italian for the time being, but I guess they can be easily translated into English. So guidelines can be made available to all of you on how to best regulate the practice of social workers, and also guidelines on how to support vulnerable families. Those are really the early stages that she mentioned. And that is very much the most difficult moment, because it means that you're setting up, you're establishing those very key tools that may prevent institutionalization of children. And I have to be honest, now with little help, sometimes families can actually resolve situations that could actually become far more severe in the long run. And those problems are being fixed at the very beginning so that they don't become irreversible. So my piece of advice is very much never to neglect the first signs, and adopting the most important tools to very much prevent, so that scenarios won't get stuck, won't be in a stale. As far as your second question, so what do we mean by residential community? Well, actually, let me tell you that we shifted from institution per se, so institutions being managed, being led by religious people most of the times, and by nuns and so on. And these people were actually welcoming hundreds of children. But then the lawmaker, through the law dated 2000, well, the lawmaker decided to shut down these large institutions starting January 1, 2007. So those very big residential communities, they do not exist any longer, starting from January 1, 2007. Those are not there anymore. So with those institutions with very large capacity, those are not there anymore. But the lawmaker has developed a different option. So whenever it is now possible to rely on foster care, at that point, the child, especially if there's a special needs for intervention. So let's say those are scenarios where we cannot rely on foster care, or in those scenarios when foster families are not available in that geography, at that point, the child can be entrusted in a family-based community. Family-based in Italy, it means two things. But let's say the two key items. Either we have a family, so a real family, so mother and father, husband and wife, a married couple who has decided to open their home, to open their house, to welcoming children in need. And this is what we call the house family. So we call it the casa famiglia, house family. Or else we do have a married couple. Well, actually, we do have a couple. So we do have a man and a woman. Not necessarily they are a married couple, but they're still replicating the same dynamics as I've mentioned for the married couple style. So either they're married or not married, but there has to be a man and a woman welcoming children to the private home. And this is what we call the family-based community. Something that I need to emphasize here. So this very last option can welcome very few children. And special authorizations are needed if that number exceeds number 6. So there can't be any more than 6 children in every community. So very small number. Thank you so much for your question.
Thank you so much, Madam Adriana, for your presentation as well as the response that you provided to the questions that have been raised. A point of take home is what you talked of having the guidelines for family foster care that are actually informed by research, which you did, and which is also putting to the test the use of the principle of appropriateness and suitability. Thank you. At this point, I wish to also recognize the presence of Mr. Wandeo. Mr. Wandeo, welcome. Again, I wish also to invite the CEO for the National Council to also give his presentation. Thank you.
Thank you. On Gabriela, Director Andiera and Adriana, Sylvia, Michelle, interpreters, and the entire team of our colleagues from Italy, our delegates from Kenya, GOK officials, Mtoto News technical team members, civil society organizations, partners, and all participants. Once again, good morning. I should sincerely say that we are delighted to have a session of this kind. And as one of the earlier speakers have said, it is indeed very gratifying to see that distance has not separated us at all, much as distance between Milan and Nairobi is far, and Kenya and Italy is far. This is only a space, but our collaboration will not be stopped by this whatsoever, and we will continue partnering in the best interest of our children. I should thank all the organizers who have taken part in making success this exchange program in one way or another. I'm sure it had taken the commitment and the determination of a team who are burning the midnight oil to make sure that it's a success. Thanks to them. Thanks also to the government of Italy for joining us in furthering the best interest of our children. It's indeed encouraging that we are connecting overseas to make sure that we attend to the plight of our children, and especially those children who need to have families and alternative family care. In our African setup, foster care was indeed part of the extended family social responsibility. And it usually took the form of kinship social foster care, kinship foster care. However, with the change of time and the weakening of the societal and communal traditional systems and norms, the practice has somewhat weakened, but still it is by and large a practice that is also traditionally esteemed and practiced in the African context. Formalized fostering systems were elaborately actually captured in our Children's Act of 2001. And the further strengthening interventions and deliberate actions were there over time, including the alternative family care guidelines And yet now also we are just finalizing our care reform strategy, where beside the overall change on the way we care for our children, we are also focusing largely on foster care as one of the alternative family care systems. Having said that, I wish to ask for the projection to be made from NCCS, please. The National Council for Children's Services, it was part of the request that we get introduced to the National Council for Children's Services. The National Council for Children's Services is the government arm that usually is concerned with policies, and the National Council for Children's Services is established as Section 30 of the Children's Act to exercise general supervision and control over the planning, financing, and coordination of children's rights and welfare activities, and to advise the government on all aspects therefore. The Council therefore has roles, a regulatory role. It also has an advisory role for the government. It has a coordination role on all matters of children. It also has an oversight role. In details, some of the mandate of the Council include determining priorities in the field of child welfare in relation to socio-economic policies of the government, to plan and supervise and coordinate public education programs on welfare of children, provide technical and other support services to agencies participating in the child welfare programs, prescribing of training requirements, participating in ensure that full implementation of Kenya's international and regional obligations, working towards the provision of social service essential to the welfare of families in general and children in particular, consider and approve or disapprove child welfare programs proposed by charitable children institutions, formulate strategies for public awareness in matters touching on the rights and welfare of children, and the establishment of children institutions in accordance to the prevailing regulations, establishment of very advisory councils, which is one of the issues that we will also, I will also have to explain later, a unique structure in the service of children at the grassroots level in Kenya, create an enabling environment for effective implementation of the Children's Act and laws relating to children, and design and formulate policy, planning, financing, and coordination of child welfare activities. Having said that, the care reform and about the national care reform strategy for children in Kenya. Care reform is a change process in the systems and mechanisms that provide care for children separated from their families or at risk of separation. And we focus on three things: prevention of separation and family strengthening, alternative care for children, tracing reintegration and transition to family, and community-based care. As I had earlier mentioned, we are now at the final stage of completing our care reform strategy. It was instigated by the pilot encounters realization that there was need to have some guiding tools and framework in place for successful transition of child care from institutions to families and communities. It was developed through a multi-sectoral care reform core team comprising of state and non-state actors that was established after some work from the demonstration counties has been realized. The development of the strategy began in March 2020. The care reform concept and terms of reference for the consultants were then developed. It was developed through a very thorough consultative process where consultation and key informants interviews were done with 120 stakeholders from different groups. including state and non-state actors. Analysis of findings also from the key desk review and consultation meeting was done. Draft 1, Draft 2, and Draft 3 have already been discussed, and the fourth draft is ready for validation. And within the month of July, we expect actually to have finalized it. The strategy has been completed and awaits endorsements by topmost leadership of the Ministry of Labour and Social Protection. The delay that was there has now been resolved. It's also important to note that the strategy will provide a guide on various approaches and modalities on how to retain children within families and communities and to prevent them from separation from their families and ensure those children in institutions are successfully reunited and reintegrated back in families and communities. It's also important to know that the strategy has been developed to take phases within a period of 10 years. A transitional guideline, communication and advocacy guidelines, and monitoring implementation framework will be developed further. Costing of the strategy also will be done. Within this period of the unprecedented COVID-19 dictates, there were also some interventions that have been taking place. This included government advisory to remove children from institutions, and half of the number of children in institutions, or close to half of the number, have been removed from the institutions. The immediate impact of COVID-19 on vulnerable and at-risk children has been manifested, however, in many ways. But there were also positive notices in like removing children from the institutions. The long-term impact of the COVID-19 pandemic on vulnerable and at-risk children is yet to be seen, but with evidence of the socio-economic impacts we have seen, it could still potentially inspire an increase in the coming back of children to institutions. However, the strategy also addressed how best we could combat this. We can go to the next slide, please. On ACs. Okay. Now, for area advisory councils and alternative care committees, as I said earlier, area advisory councils is a unique structure within the Kenyan system. These are grassroots structures which operate mostly at the county and the county subunits which are there, like the sub-counties, the divisions, the wards. They were initially established through a presidential decree in 1992 by a directive of the president then, and initially carried the name District Children Advisory Committees. They had to be taken that name because at that time the government development policy, implicit and implying at that time, was called the RDF strategy, the Rural Development Focus. And this rural development focus was a district-based thing. It was a district focus for rural development. So they had to also adopt the name as District Children Advisory Committees. Government services at that time were from the national to the district level, the understanding that the local people understood their problems better. However, during the period, membership was not well defined. All head of departments from line ministries dealing with children, all NGOs, faith-based organizations, community-based organizations are welcome to participate. And very large numbers could be comprising. There were various subcommittees also under the committee, depending on the expertise and the area in which different members were dealing with. Funding was somewhat problematic. With the amendment of the Children's Act 2001, these structures were renamed to the Area Advisory Councils. This also aimed to broaden the area of operation and the context of these committees or this structure from the district to other level structures wherever a child was, including even village level, divisional levels, ward levels, locational levels, so that no child was left out. Under Section 33(2)(q) of the Area Advisor of the Children's Act, the Act has mandated NCCS under Section 33(2)(q) to establish area advisory councils to specialize in various matters affecting the rights and welfare of children. The council developed guidelines in order to promote effective coordination and maintain standards of AAC formations. Further, in 2010, the country has had a new constitution, and in line with the constitution, the country has gone county-based development and administrative approach. And with that also, our new children's bill focuses also on the county advisory committees and sub-county advisory committees. So as I had earlier said, these are structures deliberately intended to ensure that children are catered for at all levels where they are, right from the national up to the grassroots level. And even at times, our AACs may operate up to the village level. The AAC is a replica of the National Council for Children's Services, and much of its functions is driven from that function of the National Council for Children's Services. So, to be brief, some of the roles of the area advisory councils include planning and coordination of children's rights and welfare programs in their areas of jurisdiction, whether at the county or the sub-county or the ward level or the locational or village level. Mobilize and allocate resources for child welfare activities in the areas, advocate and create awareness on child right welfare, advise national governments, and in this case even county governments on issues on rights of and welfare of children, regulate child welfare programs in the area, monitor and evaluate also the implementation of programs, and prioritize programs in the best interest of children. Also recommend registration of institutions where institutions, and in the latest move also, the area advisory councils also have a subcommittee among them, the care reform subcommittee, which is also responsible for the care reforms, which includes issues of foster care. For the alternative care committees, the alternative care committees being a committee of the area advisory council almost have roles similar to the area advisory council. These are intersectoral committees comprising, as I said, of both government, non-governmental and even private sector institutions. But the alternative family care committee is more likely biased towards ensuring that children get alternative family care services. It is this committee also who gives the advisory part. But I have said, as we continue implementing our care reform strategy, we expect now this will change to the care reform subcommittee within the AAC. Now, foster care in our context of Kenya is defined by the Children's Act as the placement of a child with a person who is not the child's parent, relative, or guardian, and who is willing to undertake the care and maintenance of that child. Foster care is a temporary arrangement used to benefit children in need of care and protection while their matters are resolved by the relevant authorities. We know it has a lot of merits. It ensures that children get a conducive environment. But since it is temporary, it may have also its shortcomings. Important also to note that foster care requires support supervision, regular monitoring, advocacy, and that's also all I have to say about foster care. And this brings me to the end of the presentation I had. Thank you very much.
Yeah, thank you so much, Mr. Abdinur, for that wonderful presentation. It was not only extensive, but very intensive, because you have also informed us about the mandate of the NCCS, the process of development of the strategy, and the structures thereof that are promoting the implementation of child protection, and in particular foster care. I wish also to, at this point in time, recognize the presence of Madam Karen as the head of AFC, Alternative Family Care. Madam Karen, welcome. I invite questions to the presentation that has just been made by Mr. Abdinur. Any question?
Okay. Looking at the chat on the answer session, we have a question about who funds the AACs, the activities of the AACs, and then what are the other documents? What other documents are there to implement the guidelines of foster care? Are there other tools? Is foster care streamlined in the government budgeting? That is in terms of financial support from the government. That is a question coming from an anonymous participant. We have another question. Are foster families who take up children supported by the government? That's a second question. For the Kenyan, yes, for the CEO. Do you have a criteria for selection of foster families, and do they undergo any form of training? And then lastly, the other question is, are the family-based care families vetted or supervised? Thank you.
Thank you very much. Thank you, and I think this is a series of questions almost, but again, summed out into two questions. One was the issue of AACs and who funds it. To be sincere, area advisory councils usually source their own funds, depending from one setup to another, and there is no government funding currently received. Yes. That's about funding for ACs. On guidelines on foster care, I wish to mention and again go back to what I've earlier said. The Children's Act 2001 had elaborately given guidelines and ways on which foster care is done. From the forms used as it is in part of even the schedules of the Act to how it is done. And further, there were other guidelines also developed relating to it. On funding, also I will say there is no funding that the government gives regarding foster care. And the other question was also who funds families. I would also say families also are not funded by the government. It is the families who have voluntarily accepted to take those children, and on the basis of considerations and investigations that has been done, and adjustment programs of the family environments and all these things done, that it is felt that the family has the capacity to bring up that child, and it's on the family's own volition that the child is taken up for fostering. And further, there was the final question was on, I think, still on fostering, but generally how it is regulated and supervised, exactly. Now, regulation, supervision is done by the Department of Children's Services. Regulation is done from the national level. Supervision, as I have said, is done by the Department of Children's Services. Prospective, even foster care parents are maintained in a register. There's also a foster register which is already there, showing the number of children which have been fostered. And not only supervision, but regular follow-ups, education of the foster care parents, and all these things is done by the Department of Children's Services through the field officers. Thank you very much.
I think there is one more question. Someone who has raised her hand. Evelyn, please, you can voice your question. Evelyn, are you there? Okay, I think she's having challenges to be able to talk. We can go to, because you're not able to talk, maybe you can put it on the chat, then we'll see how to respond to it. Now we can go to our next presenters. Let me allow Carla to introduce our next presenter.
Yes, before moving to the next, I would really like to thank the CEO for the extensive and informative presentation, which, as you can see, has encouraged so many questions and requests for clarifications. And thanks to all participants for being so active today. We can now move to the next one. I wish to introduce Madam Silvia Zandrini from the Municipality of Milan. Silvia, feel welcome.
Buongiorno, mi sentite? Devo disattivare qualcosa?
I hope you can hear me. Cloud, clear and loud.
Ok, vabbè, io comincio se...
Okay, then I will get started. Okay, I don't want to take any extra time. No. So today, my task will be to introduce how do we organize support to parenthood and what do we mean by social services in Milan. Now, the city of Milan includes quite a high number of children and teenagers. And when it comes to social services, we do support some 11,000 children nowadays who have a very custom type of support. When we say support, we mean prevention of the discomfort, prevention of also prevention of being taken away from the family. And then, of course, after prevention, then we go to protection in the event of abuse and event of any danger being experienced by the child in the family. So prevention, protection of children and teenagers. And thirdly, we do also promote parents' skills. So social services, they do perform these three types of activities: prevention, protection, promotion. What we have learned over time is that we really have to start from the very beginning, from early stage. And first and foremost, it is important that we take care of everybody in the family, not just the child, but the entire family. So often we do, of course, welcome stories also being told by, let's say, a neighbor saying that there's something wrong going on, and then we'll go and immediately check. And then we start applying our, of course, our supportive activities. So, of course, so everything we do, next slide, please. So what we do within the Municipality of Milan, we have divided services and programs, as you may see on the slide now. So Municipality of Milan, let's say, performs a so-called social, educational, and professional support to cater for the needs of parents and children through these different services and specific programs. And you may see in the slide what is the first level and then the second level. So the first level of a territorial professional social services, then it means that we're open to spontaneous requests of the citizens. And then we do have a second level, and this is more, this has to do more with protection, and this is what I'm in charge of most specifically. And then in this case, we do take care of children aged up until 18 years of age, but also we do take care of teenagers aged between 18 and 21, if the scenario is still a vulnerable one. So let's say that we do have these two different teams, first level or second level. In the second case, the second level, it might be that the case was submitted by this judicial authority. Of course, it may happen that the juvenile court speaks to us and then it gives us mandate on how to support and to allow foster care or else protection and so on. Now, when I speak through services being delivered, well, these services are being, let's say, further executed and implemented by a number of specialized services where we do welcome psychologists, healthcare practitioners, because they do perform they do not actually perform investigation. It's not just investigation. It is a full and very thorough analysis of the situation as is. And we do sit with families, we do speak to them, trying to understand why their case had been submitted either by the school or by the judicial authority. So I'm running through this bullet point here. And so when we say central investigation is that we just basically conduct a very thorough analysis, trying to understand what's going on. It's not a police investigation, but it is basically collecting information, speaking to them, active listening, speaking to teachers, psychologists, and we try again to analyze the overall scenario and see what we can do about it. And then we do have the foster care service, which is what my colleague Bondardo will introduce in a moment. And then we do have another service that where some practitioners allow families to visit their children whenever these children are being welcomed by family-based communities. Because, well, of course, in this case, there might be families with drug abuse problems and things like that. At that point, of course, we still allow families to see the children in a so-called controlled environment. Then we do have also emergency service scenarios. Now we may go to the next slide, please. And basically what we do after collecting information, then we do customize, we do organize a customized and individual project. And this, and basically what we do here, we do, so we do identify the needs with the family unit, and we do refer them to the individual services that they may access to fulfill their needs. And we do involve, we do engage, of course, healthcare professionals, as I said, psychologists, psychiatrists from the area. And also we do speak to school and the educational system as a whole, so that we may support and protect the minors to the utmost of our efforts. Now, when it comes, say, to social workers, basically social workers are kind of overall supervising this full process, allocating resources, allocating professionals, so that this entire system of support is being delivered. And of course, as social workers would then also double check that everything is being dealt with the best manner. Next slide, I have I've shown some kind of support that we do provide. So we do provide support to family income, educational home assistant. So in this case, it means that practitioners, teachers, meeting up with small groups of families whenever we can organize groups. Otherwise, it is a vis-a-vis. Then we do welcome also some of these children to daytime recreational centers, and then of course we do have educational communities, therapeutic, family-based, and again, very, very small number of children are being welcomed each time, and that can be either daytime or full-time. And but overall, we do support families very rapidly. I'd love to switch to the next slides, because then also I'd love to leave some room for questions. And of course, I'm also happy to take further questions later on in the next few days. So, but that said, so what are the key principles that we work by? So it's been anticipated by Champa. We do have a code of ethics that social workers abide by. The objective, of course, for social workers' efforts is to allow people to be fully supported to the point that they become autonomous and independent once again. We do have a key here for you to understand is that we do have some policies and procedures in place so that social workers may refer to them every time they have to develop a custom plan for these families. So otherwise they would just do things autonomously, and this is not what we want to do. So we want there to be some standardized policies and procedures. And the key principle is not just the one of having these policies and procedures shared amongst all of us, but also the objective is to valorize, and we may go to the next slide, please, thank you. We may also empower and value the knowledge of parents and families. And this may sound banal, but actually the bottom line here is that when you want to protect children's rights, you have to be very success, I would say, is happens when families still have the opportunity to share their thoughts, to share their actions that they would take to support the children. What is their spontaneous network of support that they will rely on? Any family might have their own skills to refer to rely on. And at times we as professionals, we don't know about this network, about these people. So let's say that this is the reason why I've introduced this slide. You know, we work in partnership with parents and families. We want to empower and value their knowledge as parents. Our job is to explore these skills and resources and make sure that they are enough. Next slide, please. I still have a few slides before I come to my conclusion. So again, it is not just a listening that we do perform only to understand what's going on, but through active and participatory listening, it means that there are different ways for us to listen, so that the approach is not just per se, but we have to be very careful, attentive, paying attention, embracing their vision, understanding what do they believe is best for the children. Unless we're able to listen actively, then we might have some pre-assumptions that we may base our decision making on pre-assumptions, and we don't want that to be the case. So the effort that we do as social workers is to come to a project that is absolutely shared. Otherwise, it won't be productive. It will just be a formal top-down approach that is being proposed by social worker that is still very little useful to become transformative for us how the child is, and not what is wrong with the parent or the family, so, but also understanding the child more, because we want, again, to be able to give families the opportunity to recover. So again, we do try to start from how is the child doing, and we try not to blame it on the family first and foremost. Social workers are, of course, struggling with this aspect, because sometimes they're very much focusing on the problems being detected in the family, and they do not wonder about how the child is feeling. So professionals and social workers, of course, they should really value people, context, and intervene to protect the rights of the child. But of course, also at the same time, intervene to protect and support parenthood. Again, when the vulnerability can be fixed. So the overall objectives for social workers is to take care not to have a decision making in place on their behalf. One very last slide.
Recording in progress.
Bambini e famiglie a costruire la loro torre, il loro equilibrio, anche se momentaneo. Grazie, mi scuso per la lunghezza.
Now we would like to call the next speaker, and then after.
Buongiorno a tutti, spero che mi sentiate. Io rimango in attesa delle slide e intanto saluto tutti, in modo particolare saluto le persone e gli operatori e i colleghi che ho incontrato nel gennaio 2000 quando ho fatto la mia visita in Kenya e appunto ho potuto vedere sia gli operatori che si occupano, che iniziavano a occuparsi di affido familiare, che stavano, con i quali ci siamo confrontati. Ho potuto visitare delle strutture che accoglievano bambini allontanati dalla famiglia e quindi ho un po' in mente anche quello che è diciamo, il territorio soprattutto di Nairobi. Innanzitutto mi spiace moltissimo perché avevamo pensato appunto in modo
that unfortunately we could not have any exchange anymore, because we were hoping next time to meet in person, and we were also envisaging of introducing the Italy way back in Italy, and we would have loved for you guys to see what's going on here, but unfortunately this is obviously not possible nowadays. Well, if you can perhaps share my slides so that I can get started. Well, let me introduce myself. First of all, I'm the technical coordinator of foster care services for the Municipality of Milan. And okay, here are my slides. Thank you very much. I'll be very short, very technical. And so the service that I take care of is taking place in the Municipality of Milan. When it comes to taking care of foster care. Well, there is a national legislation in place saying that municipalities will have to develop the relevant interventions. On Friday will be more precise on that. So the city of Milan has set up a central urban fostering service, and actually Milan is divided in 9 district units, and we do have as many foster care services, venues and premises. Next slide, please. This is a picture of a picture that was taken 2 years ago.
Recording in progress.
Può essere anche richiesto dalla famiglia d'origine, in questo caso consensuale, cioè una mamma che si rende conto che non è in grado di seguire il suo bambino, magari perché lavora tanto, magari perché lavora nel momento in cui non può andarlo a prenderle per accompagnarlo a casa, o non è in grado di fare i compiti, o lavora il sabato e la domenica e quindi il sabato e la domenica non può lasciare il bambino a scuola, può chiedere ai servizi sociali dei territori, quello che vi abbiamo detto prima, i nostri 9 servizi sociali, un aiuto. E questo aiuto è individuare, noi come servizio affidi andiamo a individuare, a cercare una famiglia disponibile ad aiutare un'altra famiglia. Ecco, questo aspetto dell'affido è un aspetto importante perché le prime esperienze di questa legge, se un bambino era stato accolto in affido familiare presso una famiglia e poi successivamente questo bambino poteva andare in adozione, quindi poteva essere adottato perché magari i genitori erano entrambi morti, erano scomparsi, non era così scontato che la famiglia affidataria potesse diventare anche la famiglia adottiva di questo bambino. Successivamente, invece nel 2015, con questa legge, fatta anche grazie a quelle che sono state un po' le spinte, le richieste delle associazioni delle famiglie affidatarie con le quali noi collaboriamo molto e lavoriamo in sintonia, è stato previsto che qualora un bambino è in affido presso una famiglia e può andare in adozione, la stessa
law so that the foster family can also become the adoptive family.
Noi siamo assistenti sociali e psicologi, siamo dipendenti del...
Who are we? We are social assistants and psychologists employed by the Municipality of Milan. What do we do? Well, first of all, we work, as we said, we have social assistants that know children quite well, and we see if there's a child that needs to be supported with foster care. So in a way, we look for foster families. Of course, we go out there and look for foster care families. We always need new foster care families in order for them to welcome our children. Most of the children who are in foster care were previously taken away from their families of origin, and they were first located in a community structure. As we said earlier, as the previous speaker said, usually it's a small community with a low number of children, and they, in a way, they replace the family. There are educators who take the children to school. There are educators who help the children with homework. There are educators who take them to see their friends. But anyway, a child cannot live in such a structure for an unlimited time period. They need to live in a family. So what we do is we look for foster care families. We get to know them. We train them. We coach them. So on one side, we support foster care families, and at the same time, we also help the local services, social services that help the children. Can we move to the next slide, please?
Ok, la prossima diapositiva.
Next one, please.
Allora, i soggetti, quella precedente.
The previous one, please. The one before. Thank you. So the children, their family of origin, and the foster care family are supported by the social services in the area of Milan, and together they have to be part of a project. So above all, the social services decide for foster care in those cases where they have seen that some other types of support were not sufficient before. So who are the players, who are the parties involved in foster care? First of all, obviously, the children. Please, slide number 8. So the children are the subjects involved, the child, the family of origin, foster care family, and the social services. These are the subjects involved. When the foster care project is ready, when it is well-defined and everybody agrees, before the child arrives at the foster family, there is an agreement which needs to be signed. A foster care agreement has to be signed. Here you can see a copy of an agreement. I'm sorry, I haven't translated it in English, but anyhow, you can see very quickly what it is about. So it is a pact, an agreement. There are some papers which have to be signed. So as you can see, on the first page, you have a name, surname of the child, a name, surname of the family of origin, name, surname of the foster care family, contact references, so telephone number, the name, surname of the social worker who is dealing with the foster care project. Everything is written on the first page of the foster care agreement. Then there are 7 pages in total. So now we're going to see only 2 of them, but there are 7 pages in total. So let's please move to the next slide. Next, please. This one. Number 10, please. 10. Slide number 10. All right. So in a few words, this is the commitment that is undertaken by the foster care family. So the foster care family commits to respecting the family of origin, taking care of the child as if it was their own child. Well, they commit to collaborating with the services. They commit to well, making everything possible in order to allow the child to keep contact with the family of origin. They commit to taking the child to school and also to working with all the other subjects in order to guarantee the welfare of the child. And also the family of origin undertakes some commitments. For example, they accept to be supported and helped in order to solve their problems. The services also commit to monitoring the situation. And then last, all the subjects sign it. So if the child is, let's say, older than 12, also 12 years of age, also the child has to sign this foster care agreement. And then the municipality of Milan writes a letter that the foster care family keeps with them. The foster care family will keep that letter, and that letter defines them as a foster care family. For example, if they go to school to register the child at school, they will show this paper, this document to the school staff. So once the foster care agreement is signed, the foster care family will receive some foster care money. So this is a sum of money, an amount of money that the municipality of Milan gives to the foster care family. This is public money. So, and it is given to the foster care family. It's not a huge amount of money. It's around 1/4 of a monthly pay slip, around 500 euros. For children with a disability, it may be up to 700 euros, or for teenagers. And teenagers who have more expenses, 600 or 700 euros. And then the foster care family, also, if they have some extraordinary expenses, for example, the children may have some dental problems, they need to go to the dentist, put the braces, the foster care family will be reimbursed for those extraordinary expenses. So you see, we have economic support for the foster care family, and also the foster care family can take part in some meetings for foster care families. So, well, who are the children? Well, these are children monitored, followed by the social services, and as Mrs. Andrilli said, well, they are seen as active subjects, so we need to be able to talk to them, and if they are older than a certain age, they also have to sign. I'd like to show you some photos of some foster care families with the children. Here they are. So I know that, well, they're very small, but this is just a small number of some of our children and foster care families. This was the day celebrating foster care. You can see our counselor, the families. These are only some of our foster care families of the municipality of Milan. So let's move on, please. The next slide. The family of origin.
È un bambino molto sportivo, ad esempio, a cui piace molto giocare, fa delle attività, e io ho di fronte a me una famiglia il cui papà fa l'allenatore di calcio piuttosto che va a correre in bicicletta. Allora questo è uno degli elementi che io tengo in mente, che noi teniamo in mente quando mettiamo insieme, abbiniamo famiglia e bambino. Quindi noi diciamo sempre che l'affido familiare è come un abito costruito e disegnato su misura della famiglia affidataria e del bambino. E quindi dobbiamo trovare proprio la famiglia affidataria che va bene per quel bambino lì. Proprio per questo motivo noi abbiamo bisogno di avere tante famiglie affidatarie, perché tra queste tante posso trovarne una che può andare bene per quel bambino con le sue caratteristiche. Quindi non è così scontato.
Available. So, you know, it's not that any child will be matched to any family, not at all. Well, actually, we've seen that if and when the foster care project works well, it is because we have done the right matching. We have found the perfect match for that child and the family. So again, we said that the foster care family will have to be available to keep contacts with the family of origin. Or to relate to the family of origin. Well, there's a photo that I'd like to show you. The previous speaker showed you a photo representing a group of families of origin. This is a group of foster care families. They meet once a month with us. We're also present, so the social service operator, social assistant, and also a psychologist is there. So they tell each other how it is going. It is a very important moment for foster care families. They talk about their experience. And according to our experience, these meetings can be managed by either the public social services or also by associations. Some foster care families belong to some associations and they guide the families along. They also organize these meetings where foster care families meet together and they enrich each other by talking about their experiences. So let's now see what is the role of the social services. Next slide, please. So this is just a summary because you know it already. So we have the social services that guide the foster care family through, but also we have our service. Well, our service knows the families, we know the couples, and so we keep on supporting them until the end of the foster care project. Sometimes foster care lasts up to 2 years. Our law says that foster care should last 2 years, but it can be renewed. So it can be prolonged, renewed. Every time we see that the problems of the family of origin have not disappeared yet, it is renewed. So foster care can be renewed many times, and every time we need to make a study. So well, the social services and also the local services will have to verify the situation. And then last, this is let's say a summary of social services functions and roles. Well, we are able to work in this way because we are supported by the law. We have the right legal framework that defines our activities. You can see, well, the social assistant of the municipality of Milan guarantees the best interests of the child. We also write to the judge of the juvenile court. That is to say, we have to draw up a report, which is then sent to the judge of the minors court. And also, obviously, we have to be there. We always have to be present, monitor, help foster care families without abandoning them, obviously. We have to evaluate always if there is a possibility for the child to go back to their family of origin. But then if, and this happens, if the family of origin is not able to recover, then the foster care project will become a long foster care project where the child will keep contact with the family of origin, but they will continue living with the foster care family. I hope I was clear. Thank you again for this very precious possibility. Thank you for allowing us to talk to a country like Kenya that already has laws supporting children. Thank you. Thanks a lot.
Thanks a lot. Thanks a lot, Madam Michela Bondardo, for the beautiful presentation. Participants, now we are at the time of questions that have been asked. Those who want to voice their questions, you are also invited to raise your hands. But now for the two presenters, we have participants asking if there is, in Italy we have a foster care operational manual, or what reference material do you have in Italy? Two, they will want clarification on the daytime foster care. They want to understand what categories of children benefit from this kind of foster care. They will also just want to understand if you could explain in relation to children of victims of armed conflicts between communities and countries. So just to get some understanding on how through foster care you are able to deal with this kind of children. And then you have clearly indicated that poverty should not be a reason for separating a child from the family. So they want to know what kind of interventions are provided for such a child by not only the national government, but also the territorial government. Thank you. Yes, so please, Silvia or Michela, you could respond to either, because we have 4 questions.
Rispondo molto brevemente rispetto.
I will reply with regard to poverty, to the question about poverty, vulnerability due to poverty. We cannot separate children due to poverty reasons. No judge at juvenile court will ever separate children from their families in case of poverty. So that will never happen. So when we only have a poverty situation, in Italy we have a so-called citizenship income. These are subsidies given to poor families. So families with a low income, they can be supported by the government, and also there are some specific supporting measures provided by the municipalities. So, well, you know, obviously it's not a lot of money. We don't live on a happy island in Italy, but at least we do have these subsidies and some measures in order to support children, low-income families, sorry. And then we also have some programs for, like, for example, adults or parents who don't have a job and they can't support their family. They are also helped in finding a new job. So there's a set of activities that are there in order to help families of origin, in order to cause further problems to the children in case the parents are poor, have a low income. And then we also have some NGOs, some associations providing clothes, food. As well as our public services, we also have voluntary-based associations at local level, regional, national. Well, in Italy, I'd like to say that school is compulsory and free of charge. So in Italy, up to, well, you know, for the first 5 years, and also there's another 3 years, the books are given for free by the government, registration is free, and especially for poor families, they can also have a free of charge canteen, transportation that is free of charge. So there are services for free and services for low-income families. So as we said, school is compulsory and for free. I'd like to reply to those two questions about my speech. Well, first of all, as we said also this morning, but I will repeat it, in Italy we have a national law that defines foster care. So as a reference, we have the national law, and also in 2012, we had the national guidance for family foster care. And this is our reference. This is like a manual for us. And as Ms. Champa said, social assistants have to go to university, they graduate at university, and at university they also study about foster care and family foster care. So they are well trained. The other question was about foster care, if it is a good opportunity or an opportunity also for armed conflict children. Well, first of all, in Italy, children who are victims of war or armed conflict, well, we don't really have them, we don't see them, let's say, but there are some children who are living in a community, they have been victims of violence, abuse by their family of origin, and well, you know, these children are quite similar to victims coming from conflict areas because they had a very deep trauma, very severe trauma. So foster care families, very well trained and educated, they can host, they can welcome also these children. And, you know, in this way, they can help them, they can support them, and allow them to live a more positive experience, a positive life. So also those children who have been victims of abuse, if they go to a better family, a family that lives, that works well, they can really enjoy the new life experience and they can be helped. Well, second comment that I'd like to make is that in Italy there is a problem, there's a phenomenon. Well, maybe you know about that. In Italy we have, many foreign minors arrive to Italy. They are called unaccompanied foreign minors. These are children, minors that mainly come from Africa, some African countries, from East Europe. They also come from countries where there's a war, where it is difficult to live. So living due to very severe economic problems. They come to Italy, but without parents. They come to Italy either walking through the mountains or they come through the sea from the south of Italy. They arrive at in the south of Italy. These children are taken care of by our institutions, and they are also welcomed by foster care. They also receive foster care. Obviously, well, first of all, they go to a community, then we get to know them better. So they go through a certain procedure, obviously. These are children who receive a foster care, speak some Italian, they understand Italian. So a high number of these children are actually receiving foster care, and we have excellent experiences. I can say we have had a very good experience from this point of
Thank you,
view.
Michela. Thank you so
I
much
hope I was
for
clear.
very clear, and also interesting to share such a different phenomenon and context of the Italian country, which maybe is not so well known. So thank you so much for the replies, the sharing of information. I would like now to hand it over to the next presentation. Thanks.
Thank you so much. I know the next presentation should be from Mr. Wandeo, followed by Madam Rhoda Mikia from Ranga County. But before that, I wish to invite Mr. Murigi to respond to some of the questions that have been asked through the chats and even the voice. Kindly, Mr. Murigi, welcome.
Thank you very much, Hudson. From the chat box, I can see there is some question on what strategies are put in place to ensure safety of children under foster care. And there are various strategies which have been put in place. First and foremost, we have a system for documentation of all children who are under foster care. And this is done through the Child Protection Information Management System, which is CPMS. We also have community structures in place who also provide checks and balances to children under foster care and all other alternative family care models. We also have regular support supervision initiatives that is undertaken. There are also efforts to strengthen families so that children remain safe within the community. Another strategy is building community commitment for safe, stable, nurturing relationships and environment for children under foster care. The other question was about the role of the communities, role of community in foster care. Kenya recently developed the gatekeeping guidelines, and these guidelines actually give a mandate for establishment of mechanisms to provide gatekeeping assistance to children within the community. And gatekeeping basically means the processes and models of ensuring that children remain within safe communities and prevention of children entering either into formal care or other modes of care other than within the families and the community. The communities also provide mentorship or become mentors to these children under foster care. They also provide or become role models of these children. Communities also support these children through socialization. And we have certain structures within the community levels in Kenya. We have what we call the area advisory councils, which have subcommittees which have been devolved and have gone lower. And we also have some subcommittees that we are calling the alternative care committees, which actually is the mechanism for this gatekeeping process. We have structures like the Nyumba Kumi, the chiefs, the communities, the churches, and FBOs. So I think the role of the community cannot be understated when we come to the issue of foster care in Kenya. So I think I've responded to the two questions, and will respond to any other question that comes in. And I think at this juncture, I want to give the mic back to the moderator. Mr. Imbai.
Yeah, thank you so much, Mr. Murigi, for answering those questions, and I believe the participants are well answered. We now wish to progress to the next presenters. And as you are aware, Kenya as a country, we are piloting the implementation of alternative family care guidelines in 5 counties, otherwise called demonstration counties, which are Kilifi, Kisumu, Kiambu, Murang'a, and Nyamira. So I wish to invite Mr. Wandeo to give his presentation on the experience of foster care in Kisumu County. You're welcome.
Thank you very much.
We hear you. Yes, we hear you. Proceed.
not be able to talk about now, but they are spelled out on how we would want to carry out, undertake that identification and recruitment and training, and then place the children and take follow-ups. Next slide. Now, allow me to say something about the overall challenges that we have witnessed during the implementation of the program. Particularly in relation to children with special needs, it's become a little bit challenging, particularly to get even kinship placement for some of these children, because of the approaches yet are not yet very clear on how we're going to manage this. Then there is also awareness that needs to be created. You know, it has to be continuous, because in some areas there is inadequate awareness on harmful effects of putting children in institutional care. Many people still do not really understand, but we believe that with continuous sensitization on the need to have children in the institution, in families, then we will be able to achieve our objective of removing all children and placing these children in family setup. Next slide. Next slide. Now, what lessons did we learn through? Hello? What lessons did we learn throughout this process? We've learned that for this program to succeed, for care reform to succeed, there is need to have a strong partnership, collaboration, and networking with all players, so that everybody is singing and talking the same language. Then there is also need to bring on board the political class, so that as they work and move and talk in parliament, they can be able to put some budget for foster care or care reform in the budget for children. Then we've also learned that child participation is very key. You cannot plan for children without children. Children have to be part and part, and acceptability starts with the child, the children themselves. And lastly, we have also learned that care reform must be integrated. The three components of care reform must: the prevention, the preservation, and all these alternative family care programs. They all must move together so that we are able to achieve the objective of taking back children to school, back to the family. Thank you. Asanteni.
Yeah, in the meantime, kindly let your questions come. Are you seeing any questions? Yeah, we wish to invite questions from participants, and I can see there is a question from Rose Mbarine. Kindly unmute yourself and ask your question, Madam Rose Mbarine. We can move to Kakai. Rose Mbarine seems to be having a technical problem. Kakai, kindly.
Sorry for joining you late. My good question could be, first of all, I want to thank your program. That's a very nice program. And I wish you escalate down on civil society that are down to earth from the counties. My question is, as much as we are trying to take children back to their homes, do we have any way of reducing now the home-based cares? Because these home-based cares are the one that takes these children, either abandoned from their homes, and then we have now come up with a program of taking back children to their homes. How are we reducing now the increment of home-based cares, child home-based cares? Thank you.
Thank you for your question. May I invite Mr. Mrigi to respond to your question?
Thank you very much for your question. I want to believe that you are making reference to the current deinstitutionalization process that is ongoing through care reform efforts, and that a lot has been done on the ground to facilitate this transitioning of children from institutional care to the families and the communities. As I had mentioned earlier, we have developed a lot of documents and to support this initiative. Just to mention a few, we have a case management guidelines which will assist social workers and case managers to undertake the process of managing cases of children through this transition. We have gatekeeping guidelines. We have foster care training manuals in place. And we have also managed to develop a case workers toolkit through the support of our good partners, including FADV and the other like-minded partners. So a lot has been done and the transition is moving on well. We have a pilot in Kisumu County, and we have also included other 5 demonstration counties so that we test if this undertaking is going to succeed. And so far, we have seen very good fruits, and we are moving on well. So the transitioning of children from formal to communities and families is moving on well. Thank you.
Yeah, thank you so much, Mr. Mrigi, for that response. Boniface Kisembe, kindly unmute yourself and voice your question.
Yes, thank you. Can you hear me?
We can hear you. Proceed. Yes, proceed.
Yes, yes, I have an issue with, there are some institutions that have, on my thinking, that have taken children to another level. I mean another level whereby the class that they put these children is a bit higher than when these children come back to the community. My concern is, what are the measures that have been put in place such that when these children go back to the communities, will still continue with a normal life or rather the life that they are used to in the institutions? Thank you.
transformation. Another question was, what is the motivation of foster care? I think generally the motivation of foster care is providing a child a family. We all realize and know that children thrive and better when they are growing within a family setup or within their community. So generally that should be the motivation. These are cultural issues which are embedded in our traditions, taking care of our children within the families and communities. Another question is, in case a child fails to get along with families, do you withdraw that child? For any successful case of a child, if a caseworker follows the correct process in the case management process, we will get very few relapses of cases of children who have failed to agree with the prospective foster parents. And you also realize that there is matching which is done in foster care, where the needs of the child are matched against what those parents can provide. So before a child is placed under foster care, some initial background checks and information is done. And as I speak, we have very few return cases in the area of foster care because of that very robust case management for integration process. So, so far those are the questions in our chat box, and we will continue responding to them as they come. And I don't know if Rhoda from Muranga is able to, are you back in the system, Rhoda? Back to Imbai.
Yeah, thank you so much, Mr. Murigi, for that response to the issues that have been raised in the chat box. At this point, I wish to inform the participant that we are having a technical challenge connecting to Madam Rhoda from Muranga County. However, be informed that the presentation that she was to make will be shared to you through the emails that we had actually done our invitations to you to attend. At this point, I wish to invite Madam Karen Ogot, the director and the head of Alternative Family Care, to also give her remarks as we near the end of this program. Thank you.
Thank you, Mr. Mbai, and everybody who has managed to be here today. I, first of all, want to appreciate all the participants who have been able to be with us from 10 to this time. That's a commitment from all of us. I want also to thank the organizers of today, and also the officers from the Secretariat, especially Mr. Mbai and Mr. Murigi, who have taken us through this program so smoothly. We are sorry that Rhoda was not able to come on board because of technical hitches. I've even consulted to find out if she can be able to be with us on Friday. But if she doesn't, we will share the presentations, and also for all the other presenters today. We want to really thank everybody and say that Friday we are closing. We want everybody still to be on board because that will be the end of our training. And I am sure that if there are any issues today, they should be very minimal as compared to Monday. FADV, we want to thank you very much, and Total News for being very focused on our training today. Thank you, and let's meet you on Friday at 10 so that we finalize the exchange program. Because as you've heard, we were supposed to have gone physically to Italy, but then it means very few people would have gone to Italy. It is a blessing in disguise that we've been able to have all of us come on board, at least of 100 participants. which is very encouraging for all of us. Thank you, and I'm sure you've learned a lot today. And you can see from Monday, it is a journey, and by Friday, we would now be able to go finally to those who are caregivers who have left the institutions. They'll be able to tell us the experiences that they had while they were in the institutions. We'll also have other presentations from the Italy side. Thank you, and God bless you.
Recording stopped.